Aloha and hi everyone. I'm Christina Higa, the co-director of the Pacific Basin Telehealth Resource Center at the University of Hawaii. And today's segment, we're going to talk about getting care via telehealth, and especially during this COVID pandemic period. But first I wanted to talk about my program. We are Pacific Basin Telehealth Resource Center, or PBTRC, and we are one of 14 federally funded resource centers in the country. So our resource center covers the state of Hawaii as well as the Pacific Islands. And we don't provide direct care, we don't provide direct telehealth services, but we do work with healthcare providers in Hawaii and the Pacific Islands to advance telehealth. In today's segment, we're going to introduce what is telehealth. We're going to talk about telehealth and COVID-19 and the impacts of the pandemic with telehealth. I'm going to talk about Medicare and some of the temporary policies that really paved the way for telehealth. I want to give you some telehealth tips as patients and family members, and then also warn you and give you some information about Medicare telehealth scams and leave you with some telehealth resources. So first of all, we are now all very familiar with all of the COVID-19 public health measures that are in place, just so that we are not exposed unnecessarily to the virus. So we have gone through the stay-at-home orders. We are all continuing to practice social distancing. And this has really been an unprecedented time. Think about all the school children in Hawaii and actually across the nation that have to learn from home. Think about the teachers that had to just quickly change their teaching to online practices, and all of us that are working from home, and all of you that are kind of stuck at home without your normal social networking. Well, in healthcare, we're also, many of us are switching to getting our healthcare via telehealth, and that's really important, and that's what we want to talk with you about today. So first, I want to just give a very brief introduction of what is telehealth. Telehealth is the use of technology for the delivery of healthcare. And there are many different types of telehealth services. You may think most common, the doctor seeing the patient via video conference, an interactive real-time video conference. Well, it may be the patient in your home. It may be the patient in your home seeing your primary care provider. But if you need to see a specialist, it may be a patient in a clinic doing a video conference with a specialist. It may also be two doctors consulting with each other, a specialist, maybe a cardiologist, and your primary care provider having a telehealth consult. So that's like real-time synchronous video conferencing. But there's also what we call asynchronous, which is another way of saying it is store and forward. So you might send a radiology image off and the radiologist reviews it. The patient's not there anymore. The radiologist will examine it and then make a determination of the diagnosis and send it back, so store and forward. Also, remote patient monitoring is commonly used now, which can be very helpful if you have a chronic disease. For example, a person with diabetes may use their blood glucose monitor at home. They'll take their blood test, and there's technology now where your monitor can actually transmit your data, so your blood test numbers, directly to your mobile phone by Bluetooth without you having to do anything. So you take your blood test, it transfers it through Bluetooth to your mobile phone, and your mobile phone actually updates that, uploads it to a database, and your healthcare provider can log online and take a look at all of the data to see what your blood glucose levels look like and help you to better manage your diabetes. And then your healthcare provider might actually contact you at another time to do an interactive video conference to talk about what they're seeing in your blood glucose levels. So that's remote patient monitoring, store and forward, but also a follow-up using video conference in interactive video conferencing. So how is telehealth delivered? Well, most people today are using their smartphones because the smartphones now are so versatile. You can use it for video conferencing very easily, clear pictures, but you can also use your tablets or a desktop computer if you need a larger screen. And also, you don't really need any special medical or clinical equipment. but your doctor may want you to have the equipment you have at home already that you use to monitor your health, like a scale. They may want your weight, your blood pressure monitors. We talked about the blood glucose monitors or oximeters, things that you are using to monitor yourself anyway at home. The doctor will probably want to have that in your session with you. But if you need other things like imagery, scopes, then there are some medical peripheral equipment that's needed. And for that, you might have to go into a clinic and then do your telehealth consult from there. But what you definitely need in any situation is you need good broadband connectivity. So that I'm talking about the internet. So you need to really have connection that is reliable, that's not kind of off and on in different places in your house. It might be a better signal in one place than the other. You're gonna have to find out where you can get the best connectivity. And actually that's caused a bit of a problem for all of us in Hawaii in really spotlighting, what happens if you don't have that connectivity, if you live in a place that, they don't have really good internet coverage, or unfortunately, if the family cannot afford the devices or the broadband plans. So this is where there's a whole big discussion now about digital equity and health equity, because if you don't have broadband in this pandemic period, sometimes the students can't go to school and you can't work and you can't even get health care as well. So it's a big issue that overall, collectively in the state, we're trying to overcome. Now I wanted to talk about the benefits of telehealth. You can probably guess, it is very convenient. You think about how stressful it is to try to get to your appointment on time and having to drive through traffic or find someone to drive you through traffic, get down to Punch Bowl, look for parking, and then sit around and wait for your appointment. So with telehealth, you can do it in the convenience of your own home. It's actually very efficient and effective. I really wanted to stress that you may not have heard about telehealth before this pandemic, but it has been something that's been developing over a long period of time. There are best practices, there's a lot of evidence-based practices of using telehealth, so it's safe, and it's not something that just kind of popped out of nowhere. I know a lot of people didn't hear about it before the pandemic, so it's easy to think that. But the other thing is that there's also potential cost savings. Imagine not having to fly back and forth between inter-island or off-island, out of state for that matter, and it's perfect for social distancing. So what services are provided by telehealth? Telehealth can be used for many different kinds of healthcare services, including primary care, urgent care, prenatal care, counseling. Counseling, we've seen it one-on-one counseling, but we also seen it as being delivered through group counseling. So, you've seen the Zoom video conferences with many different people on the screen. We've seen that transition for group counseling to use that kind of multi-purpose Zoom sessions. Diabetes management, we talked about already, home health care, and a really huge array of different specialty care services, such as neurology, cardiology, and respiratory care. So here's a list of some of the services that Medicare also expanded during this public health period. And as you can see, it goes from everywhere from office visits all the way to wheelchair management, hospital care, and annual wellness visits. So a lot of people ask, well, what is telehealth not used for? That's a good question. It's not used for in-person procedures like colonoscopies. Also, it's not used for lab work when someone actually needs to physically draw your blood. And also for pharmacies to get your medication, you may still need to go in, but for certain kinds of medication, you can order it online and it can be mailed to your home. That's the preferred way to social distance if your medication qualifies for that. But we ask you to not use telemedicine. We ask you not to use telemedicine if you're experiencing serious potential life-threatening symptoms like one-sided weakness or facial drooping or other signs of stroke. If you're having difficulty breathing or seizures, please call 911 in those kinds of emergency situations. And your healthcare provider will let you know if telehealth visit is available and if it's appropriate for the kind of care that you need. So next, I wanted to talk about how to prepare for your telehealth visit. So as we mentioned before, pretty simple what patients and families need. You need some kind of communication device. As I mentioned, the smartphone, tablets, desktop, a really good internet connection, reliable connection. And lately in this pandemic, also some people, providers have been using just plain old telephone. If there's no other way to contact the patient, then telephone during this public health emergency is being acceptable as a means of telehealth services. You might want to invest in headsets also, especially for those that are hard of hearing. If you have really nice headsets, it takes away the sound and it really improves the interaction with your healthcare provider. So next I'm going to go through this patient checklist for telehealth, and you can find this checklist on our website. The website's listed here, www.pbtrc.org. And there's actually two kinds of checklists. The first one is for a telehealth appointment that you have scheduled. Okay, so this is where you made an appointment with your doctor. Your doctor said, let's see you next time via telehealth by video conference. And so they will confirm how you're going to log into the telehealth session. We're going to ask you to write down information to share with your healthcare provider if he or she is not familiar with your medical history. So this is the same as if you were going to an in-person visit. You want to list your medications, your allergies, chronic diseases, hospitalizations, and surgeries. You also want to write down some questions that you have for your healthcare provider or a list of things that you want to remember to tell them. So, for all of us, when we go into our doctor's appointment, we walk into the office, so sometimes we freeze up and we get a little nervous and we forget, that medication caused me this little problem. I felt strange after this one, or that new pain that I have. So as you're leading up to your doctor's appointment, you want to write down a list of concerns that you want to mention during that appointment. For your telehealth consult, we're asking that and requesting, we are suggesting that you have 30 minutes before the appointment and you find a quiet place in your home for your visit. Check that your computer, tablet, or smartphones are charged up and working, and check that your speaker and your microphones and all your devices have good volume. And then make sure that your internet connection or your cellular connection is good. So again, as I mentioned, even within your house, you may find that the back room where it's quiet may not have really good connectivity and it kind of goes in and out. So you're gonna have to pick above quiet the place in your room that has better connectivity. We've been hearing from doctors that some people can't find a quiet place in their home, and so there's a lot of telehealth consults happening in their car. So they actually sit in their car with the air conditioning and do their telehealth visit there where it's private and quiet. We ask though, however, doctors have been saying they've had to ask people to please pull over, don't drive and try to have your visit, don't try to do shopping, don't multitask when you're trying to have your telehealth visit. Even as a passenger in the car, it's probably better that you find a quiet place that's not in a moving car as well. Those are some of the tips that we got from healthcare providers. Okay, so moving on to this checklist, we want you to sign on to your session using the link that's provided by your healthcare provider. When I say the link, it might be your Zoom link or doxy.me link or MyCharts link to your electronic health records portal. But this is the thing, is that so many different platforms are out there. And this is something that we're having a big challenge to figure out how to address. You may have 5 different doctors using 5 different platforms. And sorry about that, but we need to figure out for this particular appointment coming up, which platform is it, where's the link? And normally the doctor will email you or text you the link for your appointment. And finally, during your appointment, please take notes to help you to remember what the healthcare provider is telling you, and also get good contact information for additional questions and concerns after the telehealth appointment. The next checklist is pretty much the same thing, but it's a different way of getting your telehealth appointment. This is by demand only, so it's not scheduled. Let's say you would like to see a behavioral mental health specialist right now and don't have an appointment. There are services that you can find, you can check with your plans if they have on-demand appointments. So in that case, you would have to go to the portal, log on, and then you follow the rest of the checklist that I just went over. Again, this is on our PBTRC website. So just to sum up some of these tips, first of all, we want you to seek help from friends and families if you don't feel comfortable with the technology or the process. You know, you may be the most tech-savvy person in your household, but more than likely it may be your grandchildren or your children. One of the tips on technology and family support in my family is that I try to get exactly the same equipment as my elderly father because it's just easier. So if we have an iPhone, I get an iPhone, we have the same kind of headset, same kind of wireless Bluetooth connection, transmitters and all of that, because then when he calls me and he has a problem, I'm really familiar with it and I know I have it in front of me so I can walk him through the steps, so that's very helpful when you look for friends and family to help you. You might want to see if you can sync up the kind of technologies too. We would like you to do a practice run, test your camera, microphones on your device. Again, find a quiet, well-lit place that has privacy as a private space. Using headphones, I mentioned before, is really important, especially if you're hard of hearing. But remember, if you're going to invite a family member to attend the appointment with you by video teleconference, then they're going to have their own headset connected as well. There's going to be some issues with that, or they're going to have to connect in from another room and participate through another session. So if you have headsets and you have somebody else who's going to join you for the appointment, you need to work out how the headsets and audio will work out. The next thing is, don't be afraid to tell your doctor about any communication issues. So this is really important. When you walk into a doctor's office, you have a lot of body language. You can see him or her, they're right there in front of you. But when you are remotely connecting by video conference, you have to use a lot of your verbal communication to say, hey doc, I can only see your eyebrows. Can you move the camera a little more so I can see your whole face? Or don't go through the whole session, up to the last 5 minutes and say, actually, I couldn't really hear you. So feel comfortable and don't be afraid to just give your doctor some feedback about whether or not your communication with them is clear. And then they'll be doing the same for you as well. So that's a good thing to kind of check out right before the session starts. Are you hearing me okay? Are you seeing me okay? And finally, again, I can't emphasize enough, whether or not it's in person or by telehealth, bring a pen and paper and be ready for taking notes. In my case, I will attend my father's appointments and I'm always a note taker. Sometimes I don't really even know what the doctor said, but then later on after the visit, I can go over the notes with him very specifically because I was focused on taking notes. So finally, I wanted to just talk about COVID-19 and telehealth and how it's really impacted telehealth in Hawaii as well as nationally. So before the pandemic, like I said before, maybe you didn't hear much about telehealth from your healthcare provider. And that's because there was only about 20% of healthcare providers in the state that adopted telehealth. But after COVID, if you take a look at this data here, you can see it ranges from 65% to 600% increases to now the majority of healthcare providers throughout our state is using telehealth in some form or fashion. And in this next slide, I just wanted to show you the amazing surge of telehealth for Medicare beneficiaries. So the telehealth really skyrocketed in the early weeks of the pandemic. This number is so mind-boggling. It increased by 11,000%. It's hard to even imagine what that number really means, but a lot, right, in the first month and a half. And the good news is that there's a lot of studies that's looking at the seniors adoption. So that about 1,000 seniors were surveyed, And of them, about half, 52%, were comfortable using telehealth. And of those that did use telehealth, 91% reported a favorable experience, and almost 80% of them said they would likely to use it again. So as a resource center, we're really interested in knowing what made that experience a good experience. But we're also interested in hearing from you if you have any experience of saying, this was a really bad experience for me, it was challenging because of X, Y, and Z. And then we want to see if there's something that we can do to work in our community, work with our healthcare providers to improve that experience for you. So as a resource center, we are looking for that kind of feedback. The last point on this slide is that, I talked about the skyrocketing in the early phases of the pandemic. I don't know what phase we're in right now, but basically as in-person kind of services started to come back again, it kind of plateaued, it leveled off, but it did not drop. So we can say probably with some certainty that telehealth will remain a part of the way healthcare is being delivered, that will be delivered in the future, even as we move out of the pandemic and transition out into our new normal. And finally, Medicare and telehealth, I just wanted to explain some of the policies that were lifted during this pandemic, this public health emergency. And this is really important because before the pandemic, there was a lot of restrictive policies for telehealth. So for example, you could not be in your home and your provider could see you, but your provider wouldn't get paid. So you had to be in a rural area, you had to be in a health care facility. That's been lifted. It doesn't matter where you are as a patient to get your care. Also, the types of eligible services expanded. The therapy services were just added later part in the pandemic. So that includes physical therapy, occupational therapy, speech therapy. These are all temporary services that were added prior to the pandemic. These were not eligible services to use for telehealth. So your doctors wouldn't get paid for that. And also the eligible providers. Right now, Medicare made it very easy during the pandemic that if you are a Medicare provider and you can bill for Medicare, you can provide telehealth services. We need to really pay attention to all these policy changes because as we move out of the public health emergency, then these policies basically end, these waivers end. But Congress and many legislators are working towards trying to figure out what should we continue on moving out of the pandemic. I personally think that the patient's location will stay the same because that's been very successful, but I can't say what kind of services and providers will continue to be able to get paid for telehealth for Medicare. On this next slide, I just wanted to be really clear that that's Medicare and that's federal, but our state law is very progressive for telehealth. It's one of the most progressive telehealth service laws in the country. And this is Act 226. So all of those restrictions I talked about, the place of service, type of service and provider, that has been already lifted in our state law. And this was before the pandemic. So we're in pretty good shape. This is for Medicaid as well as private insurers. And so that will continue on. But for the audience that we're speaking to today, I know Medicare is really important. So we need to pay attention to where the federal policies move us in the future. So I get this question a lot. How do I know what my insurance covers? And I don't have a straightforward answer for you, but the answer is that you really need to check with your insurer and to see if telehealth is covered by your policies because there's so many different policies and plans. However, during the COVID public health emergency, most insurance companies have not been requiring co-pays or deductibles for telehealth. And I want to leave you with some information about Medicare telehealth fraud. Now, this is not unlike what you hear all the time about fraud with fraudsters trying to get your personal information, charging you for things that you didn't need. But the only difference is the manipulation is disguised as a telehealth consult or preparing for it. There was a case where the actual Medicare beneficiary, the patient, was never even talked to. They called the son of the Medicare beneficiary and asked, does your father need these braces? And the son said, no, my father's fine, he doesn't need it. But then later on, 13 braces were shipped to him, without even talking to the patients. You need to be careful about any kind of information that's given out, especially in the disguise of a telemedicine consult when you didn't even have the consult. I'm going to leave you with these tips here on that is really good for not just telehealth, but just in general, to remember that a Medicare representative will never call beneficiaries to ask or verify your Medicare numbers. They will never call to sell you anything. They will never promise you things if you give them your Medicare number. So don't give anybody your Medicare number over the telephone if they say they're calling from Medicare. They will never visit your home, and they will never call you to enroll in a Medicare program over the phone unless you called them first. Okay? And the next introduction I want to give you is to telehealth resources that are available to you. Again, we have our website here, www.pbtrc.org, as well as if you Google Telehealth Resource Centers, you can find all the other resource centers across the country. And there are a lot of videos and resources for families and patients, including the checklists that we went over in today's segment. But I also wanted to highlight AARP's website because they also have very good telehealth related information for seniors. And my final message, because I think I said final many times in this segment, but my final message to you is a message from the governor and lieutenant governor, and this is their telehealth campaign. It was Call Before You Click, and the clear message we want to leave you with is continue to social distance. We want you to continue, however, to receive the care that you need, and if appropriate, use telehealth. So call your doctor first and find out if they provide telehealth and if it's appropriate for the kind of care you need, and then click on to telehealth. So using telehealth will help you to keep yourself and your family and your healthcare providers safe. Mahalo, and thank you for your time. Here's my contact information. Stay safe and take care. Aloha.